Functional cranial relief, the ultimate neurological and structural treatment. For more information about FCR, see functionalcranialrelease.com.
So, if you have chronic headaches, you might have had some sort of surgical procedure. We've had patients that have had brain tumors removed, traumas to the head. It could even be the birthing process. Is what we find is that there becomes adhesions to a structure called the dura. And the dura stands for tough. The Latin name for this structure is dura mater, which means tough mother, actually. It has 2,000 pounds per square inch of tensile strength. And what happens is you get adhesions to this dura, and the dura wraps around your spinal cord. It goes through this hole in the bottom of your skull. It wraps around all the lobes of the brain, and it becomes the whites of your eyes and your sinuses. Do functional cranial release, what we're actually doing is we're releasing a lot of these dural adhesions, which then can really help with a lot of pain syndromes around the face, head, and skull structures. So what we find by doing functional cranial release is that we get a much better circulation through the cranial rhythm. And when we're able to circulate oxygen and nutrients and neurotransmitters around the brain and spinal cord, what we find is a lot of patients that have certain neurologic conditions like vertigo and dizziness and balance disorders, Parkinson's, dystonia, different movement disorders, migraine headaches, these patients respond very well because we're able to facilitate this nutrient delivery to the brain and spinal cord. You see, your central nervous system is extremely sensitive to low oxygen levels, and that's what's really key with this.
You see, your brain's a pretty important organ. It controls everything going on in your body. And with functional cranial release, we put that organ back together. We allow your brain to function at its more optimal performance so that you can be happier, and so the world will be a better place.